This week on Smarter Money TV, we take you into the Civil War Shark Tank, an annual competition between the entrepreneurship clubs of the University of Oregon and Oregon State University. 6 teams, 3 from each school, present their dynamic ideas for startup businesses to a panel of expert judges, live from the Ford Alumni Center on the University of Oregon campus. Good morning, I'm Michael Tuckman, Managing Editor of Smarter Money TV. Along with my broadcast partner, Dr. Philip Romero, the former Dean of Business at the University of Oregon and currently a Professor of Economics and Finance, over the next 13 weeks, we will bring you half-hour episodes focusing on business and finance to help you make informed decisions on how to manage your assets and how to make your money smarter. Each show will feature 4 segments. Number 1 will be Phil in his classroom teaching his actual classes. Segment number 2 will feature a panel of local business and financial experts we call Executive Council. Segment 3 is a focus on small businesses. It's called Small Business Journal. And if you want your business profiled on our show, please visit our website for instructions on how to sign up. Finally, we will have a segment called Job Hunt, where we will follow 4 University of Oregon and Oregon State recent graduates who are going out into the world to seek their first career job. And it will play out over 13 weeks, and we have very high hopes for that one. But for now, let's go to the Ford Alumni Center and see how the competition unfolds.
So I want to tell you a quick little bit about what we're doing here. We'll have a quick keynote speech from a gentleman named Michael Crook, who I'll introduce here in just a minute. And then we'll have 6 pitches, not necessarily in this order. We're going to do a random draw of colored eggs to figure out who pitches win. I will say that OSU will go first and U of O will go second. So we have we're going to take advantage of our home field advantage. But each team will have 5 minutes to present uninterrupted, and then after 5 minutes, I will let the judges know, the Sharks know that they can fire away, and they will start asking questions, and we'll see how that goes.
Some Oregon State University students have started a late-night delivery business to help curb those late-night cravings.
Well, you know, people like sandwiches and pizzas and everything else delivered to them. Why wouldn't they like their favorite snacks and drinks from the convenience store?
Which is why my team and I started Store to Your Door, a late-night delivery service selling snacks and drinks in 20 minutes or less.
Now, like any business, we had startup costs. Ours came to be $400, but with an average markup of over 200%, we recouped all our startup costs and then some in the first 15 nights. Now, as you can see, our profit breakdown, most of our profit comes from markup. We also average a $1 tip per order. Now, this is great because it means that as long as we sell 3 orders an hour, we can afford to pay minimum wage.
A lot of our profit comes from our 3 top-selling items, our Cool Ranch Doritos being the most profitable, and our Sprite being the most popular, selling over 30 per weekend. Now, you may be asking, how do we know all this? We keep very in-depth records of everything that we sell, who we sell them to, where we drop them off, and many more demographics about the people who we sell to. So, you may be wondering, how do we reach our potential customers? In one of 2 ways, business cards and social media. Our business cards are an effective advertising tool because they have everything that you need to place an order on the card, with our phone number on the front and an offer to like our Facebook page in return for a free soda on the back. We do this because it allows us to continually advertise to our customers and their friends online. Social media is key to our advertising because while you can lose a business card, you won't lose a Facebook page. But we realize that you can unlike our page, which is why we keep our posts interesting with memes and other social media.
So, we have several hot spots on our map, with dorms and houses leading our sales. Most of our orders are either more than $10 or less than $5.
Our presence on campus has alerted the attention of our school newspaper, the Daily Barometer, and as you saw, the local news. And this led to a 35% hike in both sales and social media in the following week. Our success has prompted us to expand both on OSU's campus and at other college campuses. We plan to, by fall of 2014, expand our delivery zone, extend our operating hours to be open every night of the week, and explode our menu, nearly doubling it in size. As far as off-campus expansion goes, we plan to model an existing company, College Work Painters, which gives students the opportunity to start and run their own business. Now, I looked into College Works Painters as a freshman because I liked the idea of running my own business, but I couldn't paint, painting equipment was expensive, and I didn't have a car. With Store to Your Door, if you can ride a bike, pack a lunch, and text, you can do this. We offer our franchisees everything they need to run and start a successful Store to Your Door, from uniforms and business cards to training manuals and how-to guides. We have different tiers for ways that people can buy Store to Your Door packs. The main difference that you get from upgrading your pack level for Store to Your Door is you keep a higher percentage of your profits. But you also get different benefits going up the ladder. For example, when you buy a silver pack, it gives you the option to buy stock directly from Store to Your Door at a discounted rate. Once we get contracts from big distributors like Coca-Cola and Frito-Lay. The main thing when you move up to the gold pack is it gives you the ability to earn 2.5% of your profit from Store to Your Doors that you recruit under you. Now, the numbers that we got for the profits that we give people aren't just out of thin air. We base these off of the 10% franchise fee that most restaurants charge their other franchises. That's where we got our figures. So, if you're interested in starting a Store to Your Door, contact us on Facebook. We'll have you set up and making money in no time.
So let me ask you one question. How many people would have to be working for you to hit $1 million in sales?
We haven't thought that far as $1 million. We've been keeping our sites a lot smaller just to be more realistic with what we have right now.
Well, let me ask you a different way. What do you think your market availability is for, say, just Corvallis alone around the campus?
So I did the math, and I calculated it based off of what a regular convenience store makes.
Yeah.
And we figure that we can earn $2,000 to $3,000 in profit with the current team that we have right now every month, which is 4 guys. And that's with a car as well as bikes and other methods that we have to make orders a lot faster.
Okay.
And you're paying insurance for the car and bikes and the people you're employing?
Well, we're just riding bikes for now. The car is a later model that we're going to do. We've looked into insurance for buying cars, and it's about $50 a month for the rate that we got quoted.
So you don't have any liability insurance for the people running around on bikes?
We don't have any liability insurance as of now. We're an LLC currently. We do take all safety precautions that we can. We provide helmets, lights, and everything else. We have looked into liability insurance, and we're in the process of getting it. We just haven't gotten that far yet.
There's one more on that note. So are the people who work for you, the people who deliver,
Yes.
Are they independent contractors to you guys, or are they actually employees of the LLC?
They are all working on equity, and they are partners in our business.
Okay.
Hi, I'm Oliver, this is Orion, and we're the founders of Orchid Health. We're changing the way people pay for their primary care by taking advantage of a little-known clause in the Affordable Care Act. So, we all know the problem with the health insurance industry, or the healthcare industry in the US. The costs are going way up, deductibles are on the rise, and quality is decreasing at the same time. And the reason for this is that health insurance is involved at even the most basic level of care, which is a problem. Take a look at a normal visit to your doctor for, say, a possible case of pneumonia. All the red boxes are where insurance companies are involved, clearly complicating the process. Now, take a look at how streamlined the process is when we remove health insurance with our solution, Direct Primary Care.
An Orchid Care membership offers patients unlimited clinic visits for an average of $50 a month, and there are no copays or any hidden costs. So who's going to buy an Orchid Care membership, and why will they buy it? Well, it's an affordable option. Right now, there's an increasing number of individuals and businesses that are purchasing high deductible insurance plans, which means when they go to the doctor, they're still paying out of pocket for most of their healthcare costs. So when purchasing an Orchid Care plan, And then combining it with a high deductible plan, patients can save hundreds of dollars in their monthly insurance premiums. Also, imagine being able to discuss your healthcare symptoms with your doctor over the phone or webcam, having your prescription emailed to you and saving an entire trip down to the clinic. We're able to offer this because we're not tied into insurance reimbursement for everyday healthcare. Again, for the price of a gym membership, patients are covered for 80 to 90% of their healthcare services. As a business, we're able to increase our clinical efficiency by 40%. That flowchart that Oliver discussed, all those red boxes are when insurance companies are involved, and we're removing those. We're also able to greatly reduce our costs in doing so. Also, our providers are able to focus on providing the highest quality care to patients instead of worrying about what's reimbursable and dealing with insurance companies in every visit. So this results in happier patients and higher job satisfaction for our providers. The timing couldn't be better. Oliver mentioned a clause in the Affordable Care Act, which allows our model to be listed on the health insurance exchange. So now when patients go to sign up for a healthcare plan, they can also buy an Orchid Care membership at our clinic right at one-stop shopping on the exchanges. The second part to our strategic plan is to locate in medically underserved areas, which are shown in red in the state of Oregon here. And by locating in MUAs, we're able to become a certified rural health clinic. And this allows our reimbursement for Medicaid and Medicare to underserved populations to be nearly twice as high as other clinics.
So this is a pretty unique solution, and we've got a unique team that developed it. Orion and I are the founders of Orchid Health. Orion was Oregon's 2013 Student Impact Entrepreneur of the Year, and I've got a background working with startups. And we also work closely with Erica Bliss, who's the CEO of a direct primary care chain called Q-Liance out of Seattle, and they have about 6 clinics, and they recently raised $27 million in venture funding from the likes of Jeff Bezos and Michael Dell. And we also meet weekly with Mitch Boriskin. He owns the local Eugene Urgent Cares, and he's grown his practice from 1 to 6 clinics over the past 5 years. Plus, we work with John Broom, Oregon State Professor of Business, and he actually changed the law in Oregon so that direct primary care clinics are allowed to operate. So you can see here, this is our first pilot clinic, which we'll be opening out in Oak Ridge, Oregon. Oak Ridge is a community of about 4,500 people an hour southeast of here, and 80% of their healthcare services that they demand go unmet locally. So there's a huge opportunity, and we've made some great progress on opening our clinic. So far, we've secured $88,000 in funding without giving up any equity, and we've partnered with Lane County to create the first ever telebehavioral health program in the county. And we've started interviewing candidates for our providers. We have a part-time doctor, clinical administrator, and medical director already on board. We really like healthcare because it's not an app or some consumer product. It's something that everyone needs, and which is why by targeting these higher profit Medicare and Medicaid patients in rural areas and getting on the health exchanges, we'll be able to generate over $500,000 in revenue in year 1 and achieve profitability. So our strategy is to first target the medically underserved markets. You can see Oak Ridge is highlighted as just one of many areas that are waiting for this to happen since they have high unmet need. And this is a 200,000 patient market in Oregon alone, which presents a $120 million a year market opportunity for us. The second part of our plan is to link in with the employer healthcare market, which is a $630 billion industry. By partnering with direct primary care, employers can save up to 30% on their healthcare costs, and employers are already starting to establish these relationships.
Down the road, our exit options look promising. Right now, 61% of hospital groups are looking to acquire primary care clinics in the state of Oregon. We're extremely excited about the model and the future for Orchid Health and providing health care to the patients who need it. Thank you.
So you guys say that you reduce the cost because you don't have to bill insurance, but then you mentioned Medicare and Medicaid.
That's correct. So it's really a hybrid model that we're starting out with, and we're accepting Medicaid and Medicare initially because it reduces our risk. In these rural communities, Medicaid and Medicare is extremely high need. That 40% clinical efficiency number is based on Q-Liance Medical Group in Seattle, a direct primary care membership chain, and it's also kind of an industry standard when you reduce insurance billing. So we won't quite hit that 40% number initially, but we will reduce our costs, and we won't have to have a billing department on staff. We're outsourcing our billing for Medicaid and Medicare as well.
Okay.
Hey, so do the big medical providers like Providence and Sacred Heart, are these friends or foes to you, and tell me why?
Well, I'd say that they're friends because by opening our clinics out in these rural areas, we're keeping a lot of the Medicaid patients from going into their ER rooms. And a lot of these patients can't pay for the services, or if they don't have health insurance, they're not able to pay for it as well. So they end up writing off a lot of those visits. So they like this model, and they like us being able to serve the people who have these health needs that might not be able to pay for them when they come in.
Do they like it enough to do something for you besides say they like you?
We've reached out to, I think, Peace Health? We reached out with Peace Health, and they liked the idea, but in terms of funding, they didn't give us any.
They've offered to help with staffing and some other operational issues. And our advisors, we have an individual who works for Peace Health.
Yeah. Trillium really has the reason to get involved with us because they serve all the OHP Medicaid patients in the area. They're the local CCO. And by serving all the patients out there, we're lowering their downstream costs by getting them accessible primary care as the only option for them within an hour of anywhere by locating in Oak Ridge.
Yeah, they have $500,000 earmarked for healthcare expansion in Oregon to increase access, and so we're hoping to tap into some of that funding as well. And that's for here in Lane County.
So do you have any idea on what the conversion rate might be on that? So 40% say they're interested. How many people, what percent do you think will actually do it?
Well, the way we worded the survey was we described the services and then we gave them the price and we said, would you sign up for this if this was locally available right now? And 35% said yes. So that's what we go off of right now, but we're projecting a 17% market capture in year one and then growing that 10% for the next 2 years and then topping out there.
Okay, so did I just hear you right? You said that 35% said that they would do it right away, but you took it back to 17, you cut that in half?
Yeah, just in case we
That's
want to be
good.
conservative.
35% of respondents, not of the whole market.
Right. So that's probably not a bad assumption. Yeah.
So, have you? So just so I understand your model, so you'll be hiring care providers in each of these underserved markets.
Yes, nurse practitioner or physician's assistant, since they're about half the cost and they're able to practice independently as a rural health clinic.
What challenges do you see to attracting people to those markets?
Well, that's what everyone told us is that rural health clinics and rural locations, it's very hard to staff there, which is why we started recruiting in January. We posted with 9 different universities with programs for PAs and FNPs. We've got on PA job boards, FNP job boards on a nationwide scale, and we have 4 staffing agencies working for us. And we've had probably about 10 applicants, we've interviewed 6, and we've had 1 out for a site visit. And providers really just like the model a lot because they don't have to deal with insurance companies. They get to spend 20 to 30 minutes providing care to patients, which they love. And there's also a good subset of providers who really value a rural community. Like the risk assumption a bit. The good thing is that the high-risk patients are the elderly and the low income, and that's Medicaid and Medicare. So we cut those right off the bat. And then in terms of data, people come to a primary care clinic 3.2 times a year on average. With direct primary care, they come 5.14 times per year. We're profitable until they come 8 times a year.
Last question.
What's your I saw you pick a bunch of cities, but is there a lower threshold where you say, if the city is less than 2,000 people or something, we won't go there, or if it's more than 50,000, we won't go there?
That data is from the Office of Rural Health, through OHSU we're working with, and those 20 communities I picked out of, I don't know, 100 communities, and they all had over 4,000 people, and they had
over 64% of need not being fulfilled.
Cool.
All right. When you did, last piece of that same question, so when you did that same math, what's your minimum number of monthly subscribers you need?
With our current projections, we have about a third Medicaid, third Medicare, third direct primary care, so we're projecting 350 people to sign on, scaling throughout the first year.
All right, cool. Thank you, guys.
All right, so we're the Downside Up Streetwear Apparel. I'm Dane Foreman.
I'm Blake Bouchard. And I'm Mitch.
So as we said, we're a premium streetwear apparel company. Street culture is known for having unique and authentic people. These people crave clothing that speaks to this personality and style. We pride ourselves on making authentic, high quality, and rare clothing by keeping everything in low amounts in creation. Right here you see the equal to none sign, and that's us and our sign and symbol talking about our authenticity.
So this is a few parts of our About Us, and this is our mission statement. We provide authentic, high quality, and rare clothing for the fashion-oriented street culture. And because we're authentic, We want that to be reflected in our designs, our company, and everything that we do. And by rare, we mean that we don't want our products to be oversaturated in the market, and we want our consumers to feel like they have something special when they wear it and when they buy it. We also wanted to point out some flaws that we see in streetwear in our competitors. This first example is a company called Diamond Supply on the left there. And instead of using high quality tags like we do, which is that middle picture, they just print it in, and after some washing, it might just start chipping off. The second example is a company called Pink Dolphin, and that figure in there is Boo, owned by Nintendo. You probably are all familiar with that. And blue hair is like the references Versace, and they actually call this design Boosachi. And somewhere along the line that they're going to run into legal issues because they don't own that name or figure. The third example is a company called Stussy, and I actually own personally a few Stussy shirts. And after washing a few times also, it gets stiff and uncomfortable to wear, and that does not speak to quality.
So these are our products. Starting in all products, we have a gold tag here, and this is our trademark for authenticity and high quality. Most companies want to take the shortcut and don't care about their tags and little details, and that's where we pride ourselves.
All right, so we have a local presence in Poland, and we're starting to build one up in Oregon State. We're talking the Barometer, which is a newspaper to let the student body of Oregon State know that we're a new upcoming company. Our site launched 2 weeks ago. We've contacted rap artists throughout the nation, and we have actually been contacted by rap artists, one from the company Young Money Entertainment, Torion. That's the #1 record label in the country. That have artists such as Drake, Tyga, DJ Khaled. I'm sure some of you guys know. Another big part of streetwear is shoes. Just as shoes are sold in limited editions, so is our clothing, and it comes out in marketing as well. We market our clothes as rare, and that's authentic. We have athletes who are customers throughout the country. Adrian Johnson from USC who purchased our material. Kingsman from UMass, and as you can see right here, former Duck and NFL bound Avery Patterson, who showed us out yesterday. They got tens of thousands of views. And actually, we got contacted within the past 24 hours from that tweet, people who wanted to collab with us and sponsor us. We had one person from Vine who had 56,000 followers who wanted to shout us out.
For sales channels, we have an online retail website. Here it is, www.thedownsideupcompany. We have the shop accessible in the middle in that picture and up top because that's where we want people to go.
So as far as our sales go, we sell our t-shirts for $32, our tunics for $58, and our hoodies for $70. And as you can see all the way along the board, we have very strong margins.
Here's more of our products. Beanies retail at $24, snapbacks retail at $30, still strong margins. For our vision, we aim to get into sneaker and streetwear boutiques. This one right here is Compound in Portland. It's known for presences with companies like ours, premium streetwear brands. And after that, we want to get our own brick and mortar shop, a flagship shop where we sell our own products. And also, we aim to expand our product line to sneakers because we're sneakerheads at heart. And we'd like to do that after we get our streetwear big enough and make enough profit.
5 minutes left. Open for questions.
So starting a clothing company is hard, right? So you have a lot of inventory. Have you thought about that? Like what's going to take to really start this? And
I mean, we already are started and have inventory. We're doing a good job moving it, but yeah, that's the hard part of starting a clothing brand. But like we said, we create in lower quantities, so that's one of the good things about our company. We don't have mass amounts.
Yeah.
So it's more different flavors.
So can I jump in and ask if you've already started, what are you seeing right now in terms of conversion rates on the website? People come, how many of them convert? What's the average cart order? What are you seeing today in terms of customers, how much they purchase, how much they pay? How hard is it to get customers to come in terms of buying? Are you buying traffic through like AdWords or people just finding you?
Well, we use analytics program. It's right now, so we launched it 2.5 weeks ago, the site, It would be hard to say exactly where it's coming from, but we push really hard through social media, Instagram and Twitter, because sneakers, there's a huge presence with rare sneakers online, and we know those people are willing to spend money, and there's a community. So we push through there, and they tend to go to our site also.
So how many sales have you gotten in 2.5 weeks?
15.
Okay. And whatever analytics program you're using, use Google Analytics, and it's not hard to tell where they're coming from. So measure it, get somebody to help you, but you should be able to figure out where everybody is coming from pretty easily.
Yeah, okay.
Hey, so I want to compliment you. I think the stuff is really good looking out and creative. That may be bad if I like it. I don't know. That could work against you. But you also talk about doing limited runs, small volume kinds of things. And how many people do you have currently doing design for you? Is it 3 you guys are all designers of this stuff? Or?
Me and Mitch.
Okay, so how many of anything are you willing to sell before you have to have a new design on it? So what's your lot size basically that you're willing to produce?
I mean, right now we like to keep each design under 100.
Okay.
Obviously, when you start going more nationwide and further, it kind of spreads it out more.
Yeah.
But we don't have a certain limit, but we do, we would have to think about that as we grow, but right now that's about it.
Is there a bigger brand out there, I don't know, like a Hurley or something that you kind of idolize and think maybe that's where we're trying to go?
I mean, the whole name, the downside up, is supposed to be looking at things a different way,
Yeah.
so we don't want to be like anyone else.
But you want to be big though, right?
Yeah.
Big and profitable, like that, you could be like other people that way. Right?
Yeah.
What are your sales so far from total?
From the 2.5 weeks, we've made just under $1,000.
$1,000.
So if we
and how much of that is profitable?
So out of 800, it's over half. It's about 500 to 600. So we projected for the year, if we took the 2.5 for the year, it'd be about 17,000, and profit would be about 10 to 11.
Who do you think you need to hire that brings something else that maybe you guys don't have the experience of? What are you missing on the team?
There's certain people that have experience in streetwear, and that alone can do something. Just having worked, knowing people, connections. I think that alone, there's a lot of streetwear brands that are made by people who came from other companies. So something like that, experience from someone else who's been there and done that.
How are you going to drive your costs down aggressively and stay true to your mission at the same time?
Yeah, so we can still buy things in higher bulk than we are now. So like if we're buying t-shirts, we can still buy them in higher bulk.
Well, that's 3 pitches down, 3 more to go next week. This is part 1 of Civil War Shark Tank. Tune in next Saturday for part 2 and the final, where we see who actually won the competition and won the $1,000 prize. Until then, I'm Michael Tuckman for Smarter Money. If you missed any part of this broadcast or you want to watch it again, turn over to KEVU and watch it from 7:30 to 8. Until then, we'll see you next week on Smarter Money TV.